The best times are to avoid the times that the sun is most prominent. So to avoid the 12 to 2 section, I try to avoid if they're going to be outside, but more importantly to obviously be in the morning or closer to dusk so the sun exposure isn't as harsh. All children less than 1, the most important thing I tell them at that point is number 1 is sun avoidance, so avoiding the sun again during those most harsh times, but also using sun coverage. Hats, long sleeve shirts, long pants. As children less than a year are less likely to be as annoyed by having those kind of clothes on during a hot time. I recommend baby shelters if you're ever out at the beach as well during those times. Once over that age, they start being outside more often. Using sunscreen, again, 30 minutes prior to a good sun exposure is extremely important. Most of it depends on what you're doing, especially if you're in the pool, you might need to apply more often. I would expect you to reapply sunscreen at least every 2 hours if they're in the pool, and then if you're outside just running around, you may consider doing at least every 3 hours. I don't feel that SPFs higher than 30 are really all that efficacious. I think once you get above SPF 30, most of it is marketing. And I think it leads to a false sense of security. I think parents who a lot of times use SPFs of 50 or greater tend to not reapply as often, where I feel the SPF of 30 reapplied generously is more likely to give better coverage. I'm not sure I recommend any sunscreen for babies less than 6 months. Okay. And I talk about the babies, they're mostly talking about kids from 6 months to a year. I think they're fine to use if you want to find the absolute baby ones, but again, any sunscreen is better than none if you're going to be outside during a significant period of time. I feel you should be using sunscreen pretty much all the time if you're going to be out for an extended period of time, absolutely. And being very wary, because you can't have a sunscreen overdose is the most important thing. Knowing that most skin cancer comes from the exposure children have in the first 10 years of life makes it so important that our children don't burn. It does happen quite a bit, especially when you're out, I find in pools or at the beach. Reapplying sunscreen when they're wet, sometimes it'll come right off, and accidents do happen. You may forget about reapplying at some point or miss a spot. Burns do happen. The best thing after there is just doing supportive care with remoisturizing creams. Some people really like to use things that have medication to help with pain, and those kind of things are fine as well. A little of ibuprofen also can be helpful for children as they try to work through a burn. Number 1, if you're really worried about it, if you have a blistering burn that is covering more than 5 to 10% of their body, they probably need to be seen by their pediatrician and just looked at. Talk about hydration as when they have a large-scale burn across their body, they really can have problems keeping hydrated during that time. So visit your pediatrician can be very helpful. Also, again, the most important thing is follow up after that for any certain spots or moles that may have changed following a significant burn. There really is no way of reversing it. The most important thing to do is not reburning. What I commonly find is children get a sunburn 1 week, they'll come back and have the same problem again and reburn again. And there's multiple burns, one on top of another, is what really sets these kiddos up for problems later on in life, early in life. I would, and more importantly, I think they need vitamin D from just a good, healthy diet. If they're avoiding their Cokes and teas and having a good amount of dairy intake during the day, they're going to get all the vitamin D they need. It's not as important that sunscreen we think about taking it away, because we all get sun exposure throughout the day being out without sunscreen at times. So I don't feel that at times we're going on vacation that we're really supplementing our children with vitamin D. So again, the most important thing to me is using that sunscreen, protecting ourselves from horrible skin cancers later in life, and then a good healthy diet is always great for any kid. There are a lot of myths about tanning beds, but the whole point being is they are still a form of causing skin cancer. I don't feel there's any tanning beds that are at any point safe that do not increase the risk of melanoma. So across the board, I think tanning beds are not helpful. I do believe they cause problems. I do not think kids should use them at all, and do not recommend them any time.